Well, Dr. Moniz, it's great to see you again. And why don't you take a moment to tell us about yourself?
Oh, thanks, Luke. So I'm Dr. David Moniz, but please call me David. I currently work as an emergency physician as well as an anesthetist up at the Chilliwack General Hospital. Living in Chilliwack with my beautiful wife, Anthea, as well as our three wonderful daughters. And I'm currently running to be the BC United MLA candidate for Chilliwack North.
What inspired you to pursue a career in medicine?
So I actually got inspired to go into medicine from a young age. I was quite a clumsy child. I spent a lot of time in hospitals. I hit my head. I need to go in to get stitches. And as a child, that's an incredibly scary experience. It's actually terrifying. But I always had these nurses and doctors that always treated me with such care and compassion that it actually made it a lot more comforting to have to go in there and got this wonderful care. And they always got me feeling better. And I always wanted to be able to provide that same compassion and holistic care to people to not only get them healthy when they're sick, but also, more importantly, keep them healthy so they're actually able to live the best lives that they want to live.
Healthcare is top of mind for a lot of British Columbians. What was your journey like to become a doctor?
So I had a bit of a different journey to many people. And so after I finished high school in Victoria, I went to UBC to do my pre-med studies. And after I finished my studies there, I actually decided to go on an adventure. And I actually went to Australia to do my medical training.
Wow, Australia. Why there?
Well, part of it was after 16 years of being in school, I decided I needed an adventure. And I'd always wanted to go to Australia, and I figured that would be a good option. And something that gets asked me a lot is, why didn't I study in Canada? And one of the reasons was I was doing my master's degree. And one of the rules at UBC and all the Canadian medical schools is if you're doing graduate level degree, you can't apply until you've completely finished that degree. And unfortunately, I finished that 2 weeks after the application deadline. So rather than waiting, I was like, well, time for an adventure. Let's head to Australia and see what happens.
So it's my understanding you were in Australia for about 14 years. So obviously you must have finished your schooling there, but did you live there, or what happened next?
Yeah, so after I finished med school down there, I decided to actually do some my post-medical school training down there. And while I was doing that, I actually ended up meeting my beautiful wife, Anthea, and we started a family together, and we ended up having 3 daughters. So ended up staying in Australia for quite some time, starting our family. So I trained as a rural GP in Australia. And because I was doing rural GP, I also did extra training in emergency medicine as well as anesthesia, because I really believe that people should be able to access care where they live. People shouldn't have to travel away to get the care that they need. And that's a big focus of mine, is actually having patient-centric care and patient-centric programs to ensure that people are actually at the center of what we're doing in the healthcare system. And although I love my interactions with patients, I love treating patients and working with them one-on-one, I have also come to the understanding that sometimes you need to take a step back and look at the bigger picture. And by doing that, then you can see some of these issues that are happening with the health system and actually see where some of these issues are, to try and get things back on track to being patient-centered and patient-focused. And that's led me to do some different leadership activities to look at health systems and look at the bureaucracy to make sure that we're doing things right by patients to get the best patient experience and the best patient outcomes. And further to that, I've also been involved with medical education, both at the medical school and also the post-medical school level, just to help make sure that the future generation of doctors have that same patient-centric focus to keep delivering that kind of healthcare into the future.
So what brought you back to BC from Australia?
So I went to Australia because I was looking for adventure. I love BC. I grew up in Abbotsford. I love living in BC. I love living in the Fraser Valley. It's such an incredible place to live, and it's such an incredible community that I always wanted to come back here to live and work. And after I started my family, speaking with my wife, started telling her about what life was like in BC. And I started really wanting to have my children have some of those same experiences, having the same adventures that I got to have, getting to go to some of the same places I went to have, and also getting to know my family a lot better, that they haven't really had a chance to get to know my family living so far away. So decided it was time to bring the family back to the Fraser Valley to raise our family.
Awesome. Well, welcome home.
Thank you.
So amazing experience, growing up in the Fraser Valley, understanding what British Columbia is all about. What's your experience been like since being a doctor here now in BC?
Well, to be honest, Paul, it's a very different place to what I remember. And it's to the point where it's not really recognizable. When I was telling my wife about BC and convincing her to come here, I was talking about a healthcare system that was envied around the world. It was one of the best in the world. An education system that was second to none. And really supported students that were struggling and made sure that they got the education they needed and got a well-rounded education. Communities that were safe. You could go out, you could let your kids go outside and play until the street lights came on, and that was the signal to come home. And it was safe to do that. You didn't have to worry. And coming back here, I find that none of that's happening at the moment. It just doesn't feel like the same place. It doesn't feel recognizable, and it doesn't feel quite like it did when I left. And it's been a bit of a struggle, to be honest with you.
How so?
Well, it's just, I had this vision in my mind that I wanted to bring my kids back to have these wonderful experiences and have this adventure in BC, and getting to have access to that excellent healthcare system, excellent education system, and that level of safety that I was used to. It just didn't feel right. And it made me worry that I'd actually made the wrong decision bringing them back here. And I wanted to ensure that they actually had that chance to have that wonderful life that I had. And that's what I worry about.
And so what are some of the specific issues that you've seen? You talked about in a general broad sense, specific issues that you've seen since you returned that were different than when you were away.
So the biggest is the healthcare crisis. At the moment, there is about 15,000 people in Chilliwack that don't have access to a family doctor. We've got an affordability crisis where people can't afford to live. People can't afford homes. They can't afford the basic necessities of life. We've got, as I touched on, the education system. We've got it's not supporting the children. It's not including parents in the decision making. It's just causing a lot of discontinuity in the education that children are being provided. And finally is the toxic drug crisis and the result in worsening of public safety and an increase in public crime. And it's just making our community not safe.
Yeah, a lot of those things that I think ring true to me in terms of my experience of living here, and I think with to many Chilliwack residents. So in terms of the next step here in your journey, what takes you from arriving back in BC, being a doctor here in Chilliwack, to now running as a candidate for the BC United Party?
Well, as I mentioned before, like I as much as I love being a doctor and I love interacting with patients, sometimes you need to take that step back to look at the bigger picture. And when I came back and all these issues that were happening, I couldn't sit around complaining about the issues and worrying about the issues and not actually getting involved to actually help fix the issues. And that's where I decided that one of the best ways to get in to fix the issues is actually getting involved at the government level, which is where a lot of these policies are coming from. And I looked around when I made that decision. I looked around at the different political parties, and the BC United Party has the track record of getting things done. They have the policies in place that will actually get things done to actually get us back on track. And it's really about getting involved to help drive those policy reforms to fix a lot of the damage that the David Eby's NDP government has caused at the moment.
David, I'd like to thank you just, for coming back to BC and bringing your lovely family with you, but more importantly, taking a step back from your professional career as a doctor and running as our candidate in Chilliwack North. I think we are exceptionally grateful to have a candidate of your caliber to be running in our riding, and I think it would be crazy if we didn't elect you as our next MLA for Chilliwack North. Especially given, the health issues that we're facing right now, just not in BC, but here in Chilliwack itself. And, you're hearing stories of people waiting in the ER for hours and hours, and sometimes not even seeing a doctor when they go to the walk-in clinic. So can you spend a little bit of time or tell us a little bit about, your thoughts on how you go about addressing this?
So with the healthcare crisis, we have a massive shortage of nurses, doctors, and also infrastructure as well. And what people are going to see is that David Eby's NDP has been spending millions of dollars on this healthcare system, and it's not improving anything. It's actually arguably a lot worse. And when you actually dive deep into this, you can see that what this NDP government has done, they've actually increased the level of bureaucracy and increased the government machine, for lack of a better word. You look at Fraser Health alone, which is the health authority that looks after Chilliwack North. They have 11 vice presidents and over 30 medical directors. That doesn't include also the nursing directors, the allied health directors, the technician directors, and everything. It's just this level of bureaucracy that's just causing a humongous amount of waste and inefficiency in the system, which means that all these resources that are being used to funnel into this government machine isn't going to the front lines, isn't going to increase the number of nurses, and isn't increase the number of technicians that we have, the allied health providers, or a number of doctors that we have. Add to that as well that when the NDP was in charge during COVID, they actually had these vaccine mandates that caused a lot of people to actually end up losing their jobs for no other reason than they decided they didn't want to get a vaccine. So basically the NDP is taking away their body autonomy, their ability to make decisions about their own body, causes these wonderful people to lose these really good paying and really effective jobs. And these are wonderful people that just want to care for people. And they can't do that now because of this NDP mandate.
David, your experience as a doctor, especially an ER doctor, must give you some pretty good insight into the issues that we were facing.
On a daily basis, when I'm working in the ER, I see people affected by the toxic drug crisis, from people coming in after having an overdose and needing to be revived, basically brought back to life, to people actually coming in seeking help. And it's one of the most heartbreaking things I have to do is having someone that's come in that's clearly desperate for help. They want to get off the drugs. They want to go into recovery. And I have to tell them there's no spaces available. I cannot help you. You have to go back out and continue using them. And here's a phone number for a service you can call that maybe will have a space for you in a few months. A few months might be too late for that person. They might not ever have a chance to come in because they might be the next person coming in that I'm having to try and bring back to life because of the drug crisis. And this happens on a pretty much a daily basis. And it's just not acceptable. And as I mentioned before, myself, I will advocate for this with BC United and Kevin Falcon. We will make sure that we have these recovery spaces available so people are actually able to get the help they need, when they come looking for it, because otherwise you're going to miss that opportunity and you might lose that person. And this is all because of all of these policies the NDP have put in place. And instead of actually fixing the problem, David Eby and Adrian Dix decide to actually have more task forces and more management consultants coming in, wasting more money rather than fixing the problem. Myself, with BC United and Team Kevin Falcon, what we're going to do is we're going to hire back those unvaccinated healthcare workers. That's one of the first things we're going to do. We're going to get those workers back. Because that's thousands of people that are just excellent people that just want to care for people, and we'll get them back in there. That's going to help some of the shortages. We're also going to make sure to look in some of these public and private partnerships. So publicly funded care delivered in private clinics. So that's going to increase the number of spaces available for people to get care that they need. And we're also going to look at trying to remove some of the red tape to help some of these doctors like myself, who are from BC, want to come back to BC, but trained overseas. And it's an incredible amount of red tape you have to jump through to get back here. We're going to remove some of that red tape to help bring some more of these doctors, as well as nurses and other allied health professionals that are trained overseas back here. And doing these measures together, we're going to help fix this healthcare crisis that the NDP government has put us into, and we'll get it back on track.
Yeah, that's really interesting. I heard British Columbia is the only jurisdiction in North America where we haven't hired back unvaccinated workers. The only jurisdiction.
We are the only jurisdiction in North America. It's absolutely incredible that we will not hire back, that David Eby and Adrian Dix refuse to hire back our healthcare workers. There's a fantastic pool of wonderful staff that can help out in this crisis.
So, David, thanks for your thoughts on healthcare. Love to hear about that from a doctor, someone on the inside. One of the other major issues that we're facing is an affordability crisis with housing. And how do you see addressing that as our MLA and as a part of the United Party with Kevin Falcon?
This affects everyone in BC and particularly everyone in Chilliwack North. This includes the families living on Fairfield Island. This includes the farming communities out in Rosedale and Greendale, and some of the most vulnerable people that live in downtown Chilliwack as well. The cost of living is becoming insurmountable at the moment. People aren't able to afford to buy a home. So that Canadian dream of owning your own home one day is lost on the current generation. People are giving up hope of ever owning a house. And add to that as well, because cost of owning a house is going up, cost of rent is going up. So people are now having to make these really difficult decisions. Do I pay for rent this month to keep a roof over my head, or do I pay for food this month so I can feed my children? That's a decision no one should ever have to make. People should be able to afford a place to live that is safe and afford to put the food on their table. David Eby and the NDP are making this affordability crisis even worse. They've raised the carbon tax. So the carbon tax, yes, it was started by the BC Liberal government back in 2008, but it was started at $5 a ton and it was revenue neutral. The NDP have raised it significantly to the point where it costs you more to pay carbon tax than it does to pay for your gas bill, to heat your home. And they have plans to keep rising, and that's going to make our cost of living go up even higher. Plus, we have the provincial fuel tax, which adds 15 cents a liter onto every liter of gas you put in your car. That makes filling up your minivan, that's going to be an extra $18 to $20 just on every fill, just to fill your tank of gas up so you can get your kids to and from school and get yourself to and from work. this is the David Eby NDP government vision to try and fix the environment, but it's not actually fixing anything. It's just making it more unaffordable to live. What we're going to do as the Team Falcon and BC United Party, and what I'm going to advocate for Chilliwack North, is we're going to get rid of the provincial fuel tax. That's going to be gone. So that's going to be 15 cents a liter off of your fuel straight away. We're going to get rid of the carbon tax on home heating oil. And yes, we'd love to get rid of the carbon tax completely. One of the biggest problems, though, is there's a federal carbon tax. And if we get rid of the provincial carbon tax, the federal carbon tax takes over, and then we lose all control over that. We're then subject to the will of the federal government. Whereas if we keep it, get rid of as much as we can, but keep control of it, as soon as the federal government gets rid of the carbon tax, we will get rid of the BC carbon tax. That's what we've said that all along. We will get rid of it as soon as we can. On the housing affordability side of things as well, we want people to be able to own homes. So we're going to start a rent-to-buy program that's going to allow people that are already putting $2,000 a month at least into rent, that money is going to be able to go towards actually purchasing that home. So we can get that Canadian dream of owning your own home back. We're also going to look at long-term leases of Crown land that it's going to be leased to developers at a really low cost, with the understanding that they're going to have to provide housing at below market rents. So that's going to actually increase the availability of housing for people that are on lower incomes, the more vulnerable people in our communities. We're going to be able to make sure that we actually provide housing for people that need it. So as the BC United team, and with Kevin Falcon and myself, we're going to advocate for all these things to happen. So we're going to make living more affordable in Chilliwack North.
That sounds amazing. Paul and I have a little bit of experience in this. The housing issue is we're both on the board of Chilliwack Community Services here in town, and we built a housing project at the old Paramount site for long-term Chilliwack residents. There was a movie theater downtown Chilliwack, and it closed down, and was torn down. But we ended up building a housing project there for seniors and youth, and 66 units, 8 for youth and 58 for seniors. And we built that in conjunction with BC Housing, and it's been a very, very successful project. But one of the challenges is that it feels like it's just a drop in the bucket. Even though the project was large, it just feels like we're not even making a dent in the issue that we're facing as a community.
So it's a fascinating project, and thank you for telling me about it. And I do wonder how it came from a vacant movie theater to being a social housing project. Can you tell me a bit about the journey and how that all happened and how you found the process?
Yeah, it starts like any idea. It starts with a vision, and then it all comes together with execution. And the vision was quite simple. Chilliwack Community Services is an amazing organization. It's almost 100 years old. Been serving Chilliwackians for that period of time. And really our vision was to amalgamate our locations under one roof. And we thought, well, if we're going to do that, we might as well put housing on top. And it sounds like a really simple idea. Quite frankly, if we were just to go and build our own facilities for ourselves, we would have been done 5 years ago. But adding on the housing on top is a great initiative, great idea, but the execution of that took a lot longer than we expected. And it's really because of the partnerships that we had with, the city of Chilliwack. I can't say it enough. They were fantastic partners in this project. They came to the table right away, supporting the idea. And then after that, we just got bogged down. And unfortunately, we got bogged down with bureaucracy. And it's just tough. Unfortunately, with bureaucracy, it's time. And in an inflationary environment, that time adds to the construction costs. And it just took us longer and longer to really execute it.
Yeah, it was just enormously frustrating to take a project that I thought reasonably we could have done in 2 to 3 years, and taking almost 7 years to do it. And so much of it because of provincial government red tape and making the process more difficult. There just seems to be a real contradiction. The messages I'm hearing from the government is, we want housing. But then when you actually go to do the project, you're running into roadblock after roadblock after roadblock. And it's very, very frustrating. And it's only, I think, because we had such a strong board and such a strong will to do this that we're actually able to overcome. And when you hear the stories of how much this is helping people, it's frustrating that it takes so long. We had a grand opening, and we heard from a senior and a youth, and the senior was in a wheelchair, and she talked about how she did not have an accessible unit that she could afford before for rent. And so She hadn't had a shower in years. And she talked about how in her unit, she would burn her arm every time she turned her stove off because it was hard for her to reach the controls on the stove. And those are heartbreaking stories, but it's like this red tape actually really affects a person in a very, very significant way.
Yeah, that's incredible. And when we're in a housing crisis and we need these this social housing to help people that are in need, it really seems that the BC NDP government really just wants to fuel the government machine rather than actually get projects done to actually help people and actually get units on the ground. That's absolutely incredible that it took that long.
Yeah, and when you actually think about it, right? There's probably going to be photo ops out there with certain people taking credit for it. This project was done well before they were in government. This idea was not their idea. It was executed by the residents of Chilliwack.
Yeah. And that's what happened. That's why there's such a wonderful community here in Chilliwack. You get a community like this coming together, and they build and get these projects done for our community to help our community. And that's one of the most wonderful things about living in a place like Chilliwack, is that people like yourselves who go out of your way to get involved with boards like this, and then the whole community coming together to develop these initiatives, despite the government, not because of the government. You actually managed to get it done.
The other crisis you were talking about is the toxic drug crisis. So we see you hear about it in the headlines, and you hear all these people dying. But tell us, you're a doctor, you see this, I'm sure, in the ER. Tell us what you're seeing and what's going on, and how the BC United is going to address it.
More importantly, though, as residents, we see it on the streets.
This is a massive issue, and this is a massive issue not just in Chilliwack, but it's very prominent in Chilliwack. Especially in downtown Chilliwack, in the Chilliwack North riding, it's a huge problem. And what David Eby and the NDP have done is they've decriminalized the use of hard drugs. And this includes fentanyl, heroin, cocaine. All these drugs that we've been told for years are bad and are going to cause all sorts of damage and problems. And combine that with what they've started, which is called safer supply. So what they're doing is actually giving people an excess amount of hydromorphone, which is a very strong opiate medication. It's stronger than morphine. And they're giving them this medication, just giving it out as a safer supply to try and help stop them from using the toxic fentanyl. But what they're doing is, by decriminalizing the drugs and giving out the safer supply, they haven't also then started up any recovery or treatment facilities. So they're just enabling people's drug use, but they're not actually helping them if they want to stop the use of drugs. And quite frankly, that's negligent. You're giving people these addictive drugs, enabling their use of these addictive drugs, but you're not providing any care to actually help them get off of these drugs. And it's just not the way to do it. That's not showing any care. That's not showing any empathy to these patients. You need to actually help them. And going hand in hand with the drug use as well is this worsening public safety. What often happens is these people they're vulnerable, they're desperate, and unfortunately end up having to resort to a life of crime in order to fuel their habit, but also to actually afford to live and get the basic necessities. What this means is that the streets are becoming unsafe for everybody. People don't want to take their kids around downtown. People don't want to walk around. People don't feel safe going out after hours because it's no longer safe to do that anymore. You can't leave anything outside or it's going to get stolen. And further, businesses are actually not able to run because of the increasing costs of actually ensuring the safety and ensuring the security of their facilities, and then the ongoing costs of the insurance after having their business burglarized. And it's just meaning that these costs are just becoming insurmountable. So these businesses are having to shut down. And this is all because of David Eby and the NDP government having this decriminalization and safe supply. And if you actually look at the numbers, their whole argument for it was it's going to actually help people and it's going to stop the deaths. If you actually look at the numbers, the number of actual drug-related deaths have actually been on the rise since this program started. If you look at 2023 alone, there's over 2,500 people had a toxic drug-related overdose and death in BC. That is too many. And it's showing that this decriminalization and safe supply experiment is not working. When Kevin Falcon, myself, and the BC United team are elected in October, we will stop this decriminalization project. We will stop safe supply. We're going to stop enabling people to use drugs. We're going to actually help them get into recovery and treatment. We're going to set up recovery communities so people are actually able to go in, detox off the drugs, but then actually address the underlying issues that are leading to the drug use in the first place. No one uses drugs, generally speaking, no one uses drugs because they want to. There's usually some underlying reason for that. And if you don't address that, you're never really going to address the toxic drug crisis. And that's going to be the biggest focus that we're going to look at is we're going to actually help people. we're going to give them the care and the treatment that they need to actually get off the drugs and actually help them recover and get better.
The respect they deserve.
Exactly. We're going to show them some compassion and some respect.
Thank you very much, David. This has been very insightful and very helpful to understand kind of where you're coming from and your desire to run for MLA. In closing, do you have a final message for the people of Chilliwack?
I'm honored to have the opportunity to serve our community. I will work tirelessly for the people of Chilliwack North to make sure that it is the best place for all of us. I'm back home. I don't want to put things back the way that I remember. To make sure that this is a place that we're all proud of, where our children will have the opportunity to have a great future. My professional journey has been guided by a patient-centric focus, and I will fight for policies that will ensure that we put patients, not bureaucrats, first. United together, we can fix this.